topic, that is the bone loss. How is bone loss occurring and what is happening in this thing? Okay, so right now we studied the topic concept of radius of action. So radius of action, normally the question that used to come always was, what is the radius of action? That was a very common question which used to come before, but now the pattern, trend, everything is changing. Okay, so if you get a question, the answer is 1.5 mm to 2.5 mm. Okay, now we are talking about bone loss. So how does bone loss occur in periodontal conditions? Okay, so there are three ways in which the bone loss can occur. Three ways. Okay, one is by inflammation. One is by inflammation. Okay, inflammation. The second is trauma. We all keep hearing trauma from occlusion and all those things. So second is from trauma. And the third is from systemic causes. Third is systemic causes. Okay, so these are the three main causes, okay, of bone destruction. Now today we will see just inflammation because we can't go into depth of each one, but today we'll just see about inflammation. So for any inflammation to start within the periodontal tissues, what do you need? What is the thing that you need for the inflammation to start there? Yes, it is the presence of, what is this that I'm drawing here? It is a presence of bacterial plaque. It is the presence of bacterial plaque. This bacterial plaque will initially cause what? It initially caught what? It will cause inflammation of your gingiva, and that is known as gingivitis. And that is known as gingivitis. It causes inflammation of gingiva, which is known as gingivitis. Okay, here remember, it is purely confined within the gingiva. It is purely confined within the gingiva. Now, in some individuals, due to certain factors, from this gingiva, the inflammation then proceeds on to the periodontal. It goes on to the periodontal supporting tissues. Periodontal supporting tissues. Other supporting tissues of the periodontal. What is that? That is cap. That is cap. That is your cementum, alveolar bone, and your periodontal ligament. So you have your cementum, alveolar bone, and your periodontal ligament. Okay, so when the inflammation from the gingiva goes on to these supporting structures, then you call the lesion as periodontitis. Then you call the lesion as periodontitis. When the bone starts resorbing, when there is loss of the periodontal ligament structures and loss of cementum, that is when you call as periodontitis. For periodontitis to occur, remember, for periodontitis to occur, gingivitis is a prerequisite. That means gingivitis has to be present. We are talking about inflammatory. Okay, so gingivitis has to be present for periodontitis to occur. Okay, but does all gingivitis progress to periodontitis? Can I have an answer to that? Does all gingivitis progress to periodontitis? No. Yes, very good. It does not. Okay, it varies from individual to individual. It varies from individual to individual. Okay, so now we understood that what has happened, that gingivitis progresses to periodontitis, and that is how inflammation from the gingiva moves on to the supporting periodontal tissues. Okay, so now we will see how does it move into the supporting periodontal tissues. So we understood there is inflammation here. Sorry, just go back to the slide. Okay, so we have inflammation here. Okay, and then this inflammation spreads to the supporting tissues. How does it spread? It spreads via blood vessels, which is there in the connective tissue of the gingiva, This connective tissue contains what? Lot of fibers, lot of collagen fibers. And along these collagen fibers and along the connective tissue, blood vessels run to your alveolar bone, to your PDL. Okay, so through this pathway, that is from gingiva to the blood vessels. From the blood vessels, it goes into the alveolar bone. Now, there are different pathways they explain, okay, for the interdental area and for the facial and lingual area. Interdental area, this is the interdental area. In interdental area, gingiva inflammation can directly spread to the alveolar bone. From the alveolar bone, it can go into the PDL and cementum, or in certain cases, from here, it can go directly into the periodontal ligament. That is one. The other pathway is again for the facial and lingual surfaces of the tooth. Facial and lingual surfaces. What happens? Inflammation spreads via the blood vessels into the outer cortex. Outer cortex, that is from the gingival blood vessels, it will go to the periosteum, from the periosteum to the outer cortex, and then into the bone. And in some cases here also, it goes directly into the PDL. Okay. So that is what is happening. How the inflammation from gingiva reaches your bone and starts resorbing the bone. Now, what was our question? This thing, radius of action. So this radius of action, how do we correlate to this condition here? Now, if this bacterial plaque is present here, this bacterial plaque has a radius of action. That is how much? 2.5 mm. Up to 2.5 mm, this bacterial plaque or the plaque can release local factors and it can resorb bone. Okay, so the reach of this plaque is only up to 2.5 mm. If it is more than 2.5 mm, you will not have any bone loss in that region. Okay, if the bone loss occurs, it is due to some other factors. And if it is bacterial, it is due to the presence of certain bacteria which has the ability to enter into your periodontal tissues, and those are the ones which can cause destruction. Okay, so for us, what we should know, radius of action is 1.5 to 2.5 mm, and it is in this zone that the bacterial or the local factors can cause inflammation, or local factors can cause bone resorption. Okay, I hope this concept of radius of action is clear, and how inflammation spreads from your gingiva into the periodontal tissues is also clear. Okay, somebody has said, please repeat. Okay, so it's very simple. There is inflammation within the gingiva. Just a minute. Okay, red color. Okay, there is inflammation within your gingiva. This inflammation spreads down. How does it spread? It spreads through your blood vessels into your alveolar bone. Okay, now this spread may vary from in different ways. What are all the ways? In interdental area, this is the interdental area that we are talking about, interdental region that we are talking about. This is a cross-sectional view that they have given. Okay, so from the gingiva, it can spread directly into the bone. That is one. From the gingiva, it can spread directly into the periodontal ligament. Or from here, from the bone, it can go into the periodontal ligament. Simple. For the facial and lingual region, again, inflammation from gingiva first goes into the periosteum, from the periosteum into the outer cortex and into the bone. And sometimes it can go into the PDL directly. Okay, and from the PDL into bone. That we'll study in detail what happens if the pathway changes, what pattern of bone loss comes, that's all different. For time being, your basic aim is to understand how it comes or how it travels from your gingiva into your alveolar bone. Okay, I hope that is clear.